Hammertoes are a very common ailment that bedevils society. Hammertoes are a contraction of the tendons and soft tissues at the bottom and top of the toes to produce a curly toe. This is many times due to a problem with the way you're bearing weight and can be prevented if seen early enough. However, once the hammertoe kicks in, it can't be allowed to sit, because when it sits, you start changing the way the joints react to each other. And when joints rub against each other like they're doing here, they start producing some degenerative arthritic changes, and you start getting excess growths of bone. There's not much skin between the bone and the top of the toe and the bottom of the shoe. As the shoe rubs on that area, it causes an irritation. The body, in its infinite wisdom, then puts a callus there to try to keep the bone from popping through the top of the toe, which would be a good thing to do. After a period of time, if you continue to let the hammertoe sit there in that position, the bones continue to stiffen up, and after a period of time, the body cannot put enough callus on there, so the body says, let me do something else, and it starts to put on what's called a bursal sac. A bursal sac is a little cushioned area enclosed with fluid that allows to cushion the area. After a while, however, if the toe continues to sit in its curved position and stiffen, it will take and irritate the bursal sac, which is loaded with nerves and loaded with vascularity, and cause pain and swelling. When you go to a podiatrist and the callus is removed, the bursal sac feels better for a while. It does not cure the problem, it takes care of the pain. Long term for hammertoes, you need surgical correction, because these are problems that can become very dangerous as we get older in life. As our circulation diminishes, the corns and calluses that we have as a youth becomes ulcerations, where you have an opening from the outside down to the bone as you get older. Here at Adler Footcare, we specialize in minimally invasive correction of these problems. The procedure is done from the bottom of the toe. Most times you're able to get right back into a open-toed shoe and go right back to work. And the bandage is on about 3 weeks, and the problem is cured permanently. So, if you suffer from the complaints of hammertoes, please come see us here at Adler Footcare. As we say, feet shouldn't hurt, neither should their treatment. We'll see you soon.